Hi, I'm Kathleen with Northwest Canine Coalition. One of the things that we do in order to shine a light on dogs in need of a home is we partner with canine professionals. It might be a veterinarian, a behaviorist, a dog trainer, whatever it might be that might help that dog become more readily available for adoption. And then that adoption is successful from the get-go. One of the professionals that we partner with is Vanessa Rizzo of Puget Sound Veterinary Specialists. And when we first met, it was at a booth event last October, almost a year ago. And when I learned that Vanessa is an oncologist and a veterinarian, my heartstrings were pulled because I have a family history of cancer in our family. I've lost family members because of that. And I'm an animal lover and I have dogs. And so then when I learned about Vanessa's specialty, I thought, wow, this is amazing that there is a professional out there who can help these dogs that we're trying to help find homes. And some of them may need a veterinarian to help them get into their new home. Maybe it's because they've been neglected or they've been abused, or maybe they have cancer. So just knowing that there is this person, and this person is Vanessa, who is out there that I could call on should I ever need to, but that also others out there know that this is a specialty that exists and Vanessa is that person. So it gives me that peace of mind. So it's my great pleasure to introduce to you Vanessa. She is a veterinary oncologist and she's also the medical director of Puget Sound Veterinary Specialists. So that's a mouthful. Vanessa, I want to hand it over to you. I know you also have a story that's a little bit similar to mine, but quite different. And so our viewers, I know, would love to hear from you. So take it away.
Thank you, Kathleen. I don't feel like I deserve such a wonderful introduction.
You do.
Yeah, I do have a similar story. I grew up with cancer in my family. I remember a school friend in the 8th grade who had cancer in her bone. So I've known about cancer since I was a very young kid and just sort of knew that it was this disease that you get, and some people live and some people don't. And that's all I really knew about it until I got to vet school, and was really fascinated with how diverse it is, and how this thing that I thought was just one thing is really multiple diseases. Now that I've been practicing, what I love most about veterinary oncology is the fact that I get to be a very small part of a family's life, which, I didn't think I was going to get being a specialist, because a lot of specialists don't get that. It's not like the general practitioner who's, part of that dog's life from the time they're a puppy till they're a senior dog. But I get a little bit of that, and it's pretty awesome.
It's a very important part. I mean, it's huge. I mean, I cannot imagine being in the shoes where I actually need you. But should that ever happen, just knowing that you would be there, that you're there, and you have that specialty and that expertise for whatever amount of time is just, like I said earlier, it gives peace of mind.
Yeah, well, I hope you never need me.
Thank you. I hope so too. Except for now, like interviews like this.
Yeah, for this, any day of the week.
This is fun. Yeah. So that got you, going in. You went to vet school, and you put those two pieces together. Then the cancer, the oncology, and vet and animals, and which is amazing. So for us here, we would love the opportunity to be able to help more of the dogs that we come across with our partner rescues and have you available to those dogs. But in order to do that, we need money, we need donations. Yes. Yeah, we do.
Yeah, absolutely. By supporting Northwest Canine Coalition, you can provide the needed veterinary care that a dog needs in order to be adopted. Every donated dollar makes a difference, whether you're donating $5 or $500 or maybe $5,000. Each donation can provide the necessary medical care that animals need. For example, an exam at the first signs of a suspicious lump. is not necessarily inexpensive, but early detection is so important, and that can save a dog's life. I have Squish, so this is not my dog. My dog's, it's a long story. So this dog belongs to Dr. Boyd, our eye doctor, and he was adopted many years ago. He has his own Instagram page called A Pup Named Squish.
Pup named Squish.
And Dr. Boyd said you are welcome to reference that. He has hundreds of thousands of followers. He's famous. Yep, he was on Rachel Ray. So he has a facial injury. He had an injury as a puppy, and of course they, the shelter got him, and they were just, he was really messed up. And so they were going to euthanize him. Somehow he ended up in Danielle's hands, and she insisted, and she was an intern at the time, and she insisted that the doctors there do something for him. He's had 3 or 4 surgeries on his face. Squish, come here. Let's see your squishy face. This is Squish.
Hey, Squish. Oh my gosh, what a cool puppy. How old is he?
He is about 4 or 5.
4 or 5, okay.
Yeah, and a lot of people wanted to give up on him, but Dr. Boyd wouldn't have it.
Yeah, absolutely. Well, I'm so happy to have him with us. And, they talk about Canine Awareness Month. But, I was thinking about that, and I'm like, really, every month should be Canine Awareness Month, just like it is for people. And so I know there are things to do, things to check for your dog, about your dog, just to make sure, just a wellness check, basically. And so we're going to treat this regardless of what month it is. It's check your Canine Awareness Month.
I like it because I'm always aware of it as well.
Yeah, and we should be. And like with people, early detection is key in treatment and prognosis and going forward.
Yep, absolutely.
Okay, so on that note, what are some things that dog owners should be aware of, or how you want to, you're the expert. We have our dogs. I've got 3 dogs, and I'm always touching them, I'm brushing them, I'm massaging them. But there's an extra layer of awareness that I know I should be aware of. What is that? What should I be maybe testing for?
Yeah. So you had started out by saying there are certain things that we could be on the lookout for as pet owners. I'm a pet owner myself. I am not my own dog's doctor. I cannot handle that. So some of the things that you can look out for, this is especially true in older dogs, but just like in humans, we definitely see cancer in younger animals as well. So weight changes. A really, really important thing to watch out for is weight loss despite a good appetite.
Okay.
There are only a few things that will do that, and cancer is very high on the list. So you have your dog chowing down all the time, acting normal, but the weight is just dropping off of them, you definitely need to have them checked out.
Okay.
And a loss of appetite can certainly be a sign of cancer, especially if it's associated with weight loss, but I don't want anybody to panic. You should definitely have your dog checked out if they're not eating, especially if they're a lab or a golden retriever who is just like a hoover for everything. But a poor appetite is not the only thing that cancer is associated with. A poor appetite can be seen with a lot of different canine and feline diseases. So get your pet checked out, but don't panic yet.
And what is
behavioral changes?
Oh, okay. I just wanted, so my dog's losing weight, she's eating like you're saying, and I go to the vet and I explain this. What might they do? Is it a simple blood test? Is it, what might?
Yeah. So of course they're going to start with a physical exam. They're going to feel around for anything abnormal, including tumors, and tumors can be felt on the outside. A lot of owners are good at picking those up, but some tumors that are on the inside, we as veterinarians have been trained to sort of feel certain organs in the abdominal cavity, and sometimes we can pick up on a problem just through a really good physical exam.
Okay.
But cancer doesn't always show up that way. It's not always easy to tell. Sometimes, you mentioned a blood test. Sometimes there are cancers in the blood, like lymphoma and leukemia, which a blood test will definitely pick up on. There are other cancers that are internal that blood tests will absolutely not pick up on. Cancers of the kidney, liver, even in the intestines sometimes, and sometimes you need further imaging to figure that out. So if you feel like there's a problem with your pet, you go get a physical exam and it's totally normal, and you get blood work done is totally normal, go further. And
Okay.
I've definitely had some patients refer to me, and the families explain, well, a month ago we had a physical exam and it was totally normal, and the blood work was totally normal, and they told me everything was fine. If you think something is wrong, dig deeper.
Okay.
Now, most veterinarians will tell you to dig deeper, and I would say let them. And one of the things that they might want to do are chest x-rays or an abdominal ultrasound.
Okay.
I will also caution you that abdominal x-rays are not the same thing as having an abdominal ultrasound done. You can see a lot more detail on an abdominal ultrasound than an x-ray. So if you get an x-ray done and that's normal, and you think that's normal, but your pet is still acting abnormal, dig deeper.
Should we just cut to the chase and go to the ultrasound?
I prefer an abdominal ultrasound over an abdominal x-ray,
Yeah.
but chest x-rays are great.
Okay.
So x-rays to look at the health of the lungs and the heart and bones, fantastic.
Okay.
X-rays to look at abdominal organs,
not so much. Okay,
not
very
so much.
good, very good to know, because as you're saying all this, as I'm sure our viewers will be maybe thinking the same thing, it's like cha-ching, cha-ching, like, this is really going to start adding up. So don't get the abdominal.
Yeah, they're not very useful.
Yeah. Okay. Good to know. Good to know. All right. So, so we've talked about appetite changes, weight changes, behavioral, maybe not so much. If maybe
so behavioral changes. Yes, there are two big things sort of. Yeah, absolutely lethargic. A big sign, and that can be hard to tell in cats, right? Because a lot of cats, especially as they get older, lay around all day, and it's kind of hard to tell if they're lethargic.
We all do a little bit more.
If your cat always, oh, definitely, for sure. But if your cat normally follows you around the house, even though they lay around all day, but if you get up, they get up, and now they're not, maybe something's going on there. Okay. Or if they're always by your side while you're watching TV at night, and now they're in the bathroom, sleeping on the bath mat, that's weird, and you should probably have him or her looked at. Okay. For dogs, it's kind of similar. If they're always following around and now they're not, maybe something's going on, and maybe it's not just old age. And one of the other things that dogs will do to show us there's something wrong is they will, come into the living room like they always do to sit down with you to watch TV, and they'll sit down, and then they're like, and they get up 2 seconds later and they move to the other side. And then 10 seconds later, they move to the other side of the room. And they just can't seem to get comfortable. Mm-hmm. That's a little bit of a red flag to me, that something's going on internally that's bothering them.
Okay, something's in there that maybe it's, like you said, not making them comfortable. It's making them uncomfortable.
Yeah. Okay. Sometimes big liver tumors can do that, and you can't see or feel them from the outside. Okay. Some of those tumors are very slow to progress. So in the patient, it can also be a slow progression of behavioral signs. And a lot of people attribute that to old age, this slowing down and a little bit acting weird and, not doing the things that they normally do. And yes, absolutely, that could be due to old age. I don't want anybody to panic, but I get a lot of families who, you know, whatever the cancer is and whatever the signs were, I always hear, I just thought he was getting older.
Ah, yeah.
I hear that a
No,
lot.
so, but cancer can happen at any age, whether it's, I'm assuming.
Absolutely.
So just because because I have 3 senior dogs, so some of the things you're mentioning, I'm like, oh yeah, I've said those things. They're 10, you know, they're 12. It's like, but maybe I should be, you know, looking at this a little bit differently through a different lens, but not always for the senior dogs or the more mature dogs. Younger ones too?
Younger ones too. So this is a huge red flag if younger dogs all of a sudden are acting uncomfortable or not chasing the ball when they normally do. Yeah, huge, much bigger red flag in younger animals for sure.
Okay.
And again, for the older animals, don't panic, but you should be getting that yearly exam. You know, I think after the age of 7 or 8, they should be getting blood work twice a year, not once a year. And yeah, I hear you with the cha-ching and these things add up, but you know, there are wellness plans now. There's insurance that can help with pet ownership and helping with some of those costs. And, you know, sometimes preventative care is a lot less expensive than if the problem occurs and it's already in, you know, multiple places in the body. You know, that can be a lot harder to deal with.
Yes, and I hear you on the insurance. I'm so glad I have that in place because we've got our money's worth already.
Yeah, it helps a lot of the families that I'm working with for sure. It sort of takes one element of decision making out of their hands for them.
Yeah, which at a time like this, any bit will help.
Yeah,
along this course. So I know one of the things we want to get to is you're going to demonstrate what to look for in your dog or how to examine your dog at home if you're seeing some of these changes, whether it's appetite or behavioral. You know, you're just lounging with your dog maybe, especially now as we're all inside binge watching everything. What could we be doing with our dogs at the same time maybe?
Yeah, so I have probably 2 or 3 things that you can do at home, whether you think something's wrong with them or not. You can sort of do this on a regular basis. We're always petting and cuddling with our dogs anyway, and to do a couple of extra steps. Just to maybe try to catch something early. I have a few tips that I think are really easy for folks at home to do. I have to get Squish. He's laying by the door waiting for his mom. So he's a reluctant model.
Oh, don't be shy.
Okay, so I'm going to get the normal side of his face. So one simple thing you can do, not all dogs will let you do this, but you can look inside of their mouth. You don't have to pry it open. You know, you can let your veterinarian do that. But some people don't think to just lift the lip up. So you can lift the lip up and sort of spread this back like that.
Okay.
And just make sure the gums look nice and healthy. There's no like lumps or bumps in there. And then try to catch them when they're yawning and take a look. Quick, take a look in there, you know, for whatever second you have to look in the back of the mouth. I don't recommend prying your mouth open and sticking your fingers in there. It's sort of, they don't like that, and it sort of changes the relationship that you have with them if you're doing these sort of invasive things.
Okay.
Take the opportunity when it presents itself to you, when they're yawning, take a look back there.
Yeah.
Or when they're barking at something.
Okay.
The other thing that is relatively easy for, I think, sort of regular family owners to do, people who don't do physical exams every day, are to feel the lymph nodes.
Okay.
So there are lymph nodes that I can feel under the skin that I should normally be able to feel under the skin. I'm going to show you where they are. I don't expect you to be able to find normal ones. That one takes a little bit of time and some training to even find the normal ones because they're very small.
Okay.
But if I show you where they are and you're feeling that area and you do feel something or a lump in there, then it might be a big lymph node that you shouldn't normally be able to feel.
Okay. Yeah.
Okay. So right under the jaw here, where the jaw comes to a curve, here,
okay,
there's a little lymph node in there. And so when I squeeze his skin and I pinch it just a little bit, there's this little tiny bump in there. That's a normal lymph node. It should only be about this big.
Okay.
But if you, now, not everybody's going to be able to find a lymph node that's this big. But if you're doing that on your dog on a regular basis and just sort of feeling that area and you start to feel something that's this big, that shouldn't be there.
Okay.
So bring him in. The next place is in front of the shoulder.
So very similar to humans.
Absolutely.
Okay.
So in this area here,
Mm-hmm.
I have, even me being experienced, I have to sort of dig a little bit and pinch out that normal lymph node.
Okay.
But if you just pinch the skin here lightly, I'm not hurting him, just lightly pinch and sort of roll the skin. If you feel something in there that's about this big, that is not normal.
Okay.
It's this big.
And oh wait, go ahead.
The last place that's an easy place to feel a big lymph node is behind the knee, on the back leg.
Oh, I had no idea.
I'm going to turn the camera down just a little bit.
Okay.
So right here where the leg bends,
Mm-hmm.
I just take my 2 fingers and I'm sort of going up and down and pinching at the same time.
Wow.
And right here is a normal lymph node.
Okay.
Again, I don't expect you to find a normal one because it's this big. But if you're running your hands here even like this, flat, and you feel a bump in this area, that's a big lymph node, or it could be a big lymph node, and you should have it checked out.
Okay. Wow. So 3 places where you're feeling your dog anyway. You know, you're rubbing them, you're caressing their legs, especially right around here. You know, we're always petting our dogs there. It's a calming place too. So, and only 3 places: behind the jaw, the front, shoulder.
Yep, and behind the knee. Yeah.
Either knee, either sides, or both sides. You need to check both sides.
Absolutely. Yeah. And there are other places where veterinarians and trained people can feel lymph nodes, but those are the easy places that sort of a regular person can feel easily just by watching this video. They can pick up on that, and it's very easy to do.
Perfect. Now here's the other thing too. So my dogs, they have lipomas. And when I saw the first one, I was like, whoop, speed dial to the vet, and he talks me off the edge and says, no, this is a lipoma. And he was explaining the differences. But layperson that I am, each time I come across one, I'm back to the vet because, I need to be more knowledgeable about what is it really I'm looking for. I mean, I know he's told me it's this, it feels differently, its density is a little bit different. So can you explain for us lipoma versus maybe something else that we should really get checked out?
Sure, absolutely. And of course, because I'm an oncologist, I'm going to scare you just a little bit.
Yeah, I know. That's good. That's fine. I think we're going to the vet this afternoon.
Okay. So lipomas generally, I would say 95% of the time are soft and squishy. They're just underneath the skin. You can sort of pick them up and move them around under the skin a little bit. You can almost get your fingers like all the way to the other side of them sometimes.
Oh, wow. Okay.
Sometimes. If you stick your finger like in the middle of it, it kind of indents like a soft squishy ball or something, like a Nerf ball or something like that. And they're usually slow growing, usually.
Okay.
Now, tumors that tend to be more aggressive or are more aggressive or potentially metastatic are usually, but not always, firmer. They feel really hard. You can't really pick them up and move them around. Sometimes they pop up overnight, and within just a couple of weeks, they've doubled the size. That's usually not a lipoma.
Okay.
But the one sort of scary thing is that there's one tumor out there called a mast cell tumor that we as veterinary students learn that it is also called the great pretender. So we learn that in school. So we learn not to be fooled by those soft, squishy tumors and just dismiss them on sight and feel that they're just a lipoma. You don't know what something is until you test it and you put a little needle in it and make sure that you get fat out of it. I've definitely diagnosed several mast cell tumors that if I had just felt them, I would have said they were a lipoma. But
wow.
You put a needle in them, you get the cells on the slide, and you take a look at it and you make sure. So I understand for those few dogs out there that are just like reading Braille and they're just full of lipomas, that is really hard to do. But it's not impossible even if you have a dog with multiple tumors. You get your doctor or you yourself can do a body map.
Okay.
I find it online. It's just an outline of a dog, and you mark where these lipomas are. That's what I would do as a veterinary oncologist. If someone came to me who had a dog that had multiple masses, I would measure them all. I would put them on the body map. I would give a copy to the family, and then you monitor them. And if a new one pops up that's not on the map, you get that one tested.
Okay.
So you get them all tested, or test it one by one as they show up, and then put them on the map so you know where they are and how much how big they are.
That's an excellent idea, and I have not done that, but I'm doing that today. We're doing that today, and we have done the part too where it's like I'll be there and like, well, they're sure it's a lipoma. Do you want us to test it anyway? Yep, do that. And it's so quick. It's just a really quick needle poke. Yeah. My pups don't, they don't appear to notice that it's even happening.
Yeah, most dogs don't seem bothered by it.
Yeah, and for the peace of mind, it's definitely worth it.
Yeah, absolutely.
Yeah. Now, do you find that certain breeds are more susceptible to lipomas and or cancers, tumors, or it's across the board equal chances?
I mean, certainly lipomas are across the board. It definitely, I guess I see them more in bigger dogs, medium to bigger dogs. I see them in overweight dogs, but any dog can get them. I've seen 1 or 2 lipomas in a cat, which it's very, very, very unusual to see a lipoma in a cat. And even when I tested it and got fat, I told the family, I was like, this is not normal. Like, we really should probably, think about having this taken off. But it does happen occasionally in cats.
Okay.
But I wouldn't, I don't know. Cats make me nervous with their so-called lipomas. But as far as, types of cancer, yeah, I guess I see mast cell tumors more in like pit bulls, Labradors, little like Boston Terriers and pugs. They get mast cell tumors. The dogs that are prone to mast cell tumors tend to get lower grade ones. Okay. And so it's even, while it's important in everybody, in those dogs, if you have a low grade mast cell tumor, treating it early, you have the potential to cure it. And I don't get to use the cure word very often in veterinary oncology. But if you catch something like that, or a low-grade soft tissue sarcoma, and you catch it early and you get it off, I mean, your chances of curing it are very, very high. And so getting those little things taken care of before you start to see them doubling in size, or, hopefully not, but they can sometimes open up and become infected wounds, dealing with it before it becomes a problem is, like you opened up and said, it's much easier to treat cancer, and usually we're more successful if we catch it early.
Okay, so do those checks once a month, you think is good, at least minimum, or?
Once a month, but you're always petting your dog. Looking for skin tumors, I recommend using like the palm of your hand. And so usually pet by like scratching, like doing that. But maybe even just once a week, once a month, definitely, but you're always touching them. And so remember to use the palm of your hand and go from head to tail on the back, and then around the body, all the way down to the tail, all the way to underneath. Okay. And also both sides of the leg. So I go all the way around the whole leg, up and down. And so you want to feel the inside of the leg and the outside. I think sometimes we just sort of like scratch out here. You want to go flat all the way down. And the nice thing about doing that once a week or once a month is you get really familiar with what normal is.
Yep.
and where the normal muscles are, and maybe there is a little bump, but now you know about it, and next week it's the same size, and the week after that it's the same size. You've had it checked out, it turned out to be nothing, but you keep checking it and it continues to be the same size. You know, you're not surprised by anything like that, and if something does pop up, you're prepared for it because you know exactly what normal feels like in your pet.
So we're setting our baseline.
Exactly.
Yeah. Okay. Perfect. We all need to do that for our pups. So worst case scenario, you find something that's suspicious, you have it tested. Yes, it is a cancer. What do dogs get the same kind of treatments that we know about for humans? Chemotherapy, radiation, surgeries? Are there
some of them in their
approaches?
Yeah, there are definitely new cancer drugs on the market for humans and dogs as well, and cats. The human oncology world is definitely decades ahead of us, you know, and then I get families asking me about immunotherapy and different drugs, and it's definitely in the works for veterinary medicine, but we don't really have access to it the way humans do. But yes, I mean, there is chemotherapy, radiation, surgery, just like there is for people. But the side effects are different in animals than it is in people. So people hear those words and they're like, I would never do that. Why would I do that to my dog? But, you know, we do chemotherapy. We dose chemotherapy differently in animals than they do in people. We really are trying to balance quality of life with quantity.
Mm-hmm.
Not trying to gain every last day, you know, with them at the cost of their quality of life.
Yeah.
And so, of course, I want these animals to live as long as possible. You know, I want that for my own family. You know, I want to be with them as much as possible. But, you know, I don't know this for sure, but I don't think animals have goals the way we do. I don't think they think about the future the way we do. I think animals give us such a wonderful lesson in living in the moment and appreciating what you have right now, and being happy with what you have. I mean, it's so easy to make a dog happy. So we really try to focus on quality of life. And, you know, if we're giving a certain treatment, and most of the treatments I give don't cause side effects, but sometimes they do. If your dog is in that category, we change the plan. So we change the dose, or we change the frequency, or we change the drug, or we say, hey, we gave it a shot, and for this particular pet, it isn't working out. And so, you know, we're gonna try to keep them as comfortable as possible for as long as possible, but we're done with chemotherapy, and that's fine. I am certainly not the type of oncologist to try to talk people into doing treatment. It's not right for every family. But I do think that most people should at least hear what oncologists have to say, because it's not what you think it is. It's not like it is on TV with people, you know, or in your own life. You know, I know a lot of us are touched by cancer, you know, losing their hair and vomiting all the time. Right. That doesn't happen.
Well, anymore, I mean, the majority of people have been touched by cancer in one way or another. Someone they know, a family member, themselves. And so you're right. We have these horrid pictures in our minds, and then we don't want that for our beloved, you know, best buddy here.
Right. And I promise you, and everyone out there, I don't want that either.
Yeah. No, that's good to hear. And you know, we're so right about our dogs. They teach us so much, and just being reminded about its quality. Yeah. Quantity is not necessarily the best thing in life. You know, it's the quality. And so, you know, I like to say everything I know I learned from my dog, and now from you too. So.
No, I learn a lot from my own animals, and definitely from my patients and the families that I work with, for sure.
Yeah, no, it's good to be reminded about that. So, and then I sure there's, you know, holistic approaches out there too, if people wanted to research more about that. And then a lot of, you know, comfort is key.
Yeah, absolutely. Yeah, there are quite a few holistic medicines out there, supplements and treatments. There's acupuncture and massage as well.
Mm-hmm.
I would ask that anyone who finds something should at least talk to their doctor about it. If your doctor isn't willing to at least chat with you about it, then maybe they're not the right person for you.
Mm-hmm.
I can't promise that a lot of those treatments that the families bring to me will work. But I could at least research, does anything look harmful? There are some treatments that I wouldn't mix with chemotherapy. You know,
Right.
once they're high in antioxidants, I wouldn't do that just yet if we're on a chemotherapy regimen. And I also work with a veterinary nutritionist who can help us do that kind of research as well, who's way more versed in those sorts of things than I am. So I'm definitely open-minded to those things, but I would just ask that, you know, people tell their doctors about it just to make sure there's nothing harmful. And then the other little tip that I will give is that vegetables have been shown to prevent cancer or decrease your risk of cancer, not only in humans, but in dogs as well.
Okay.
I don't think we say that very much, that there's data to prove that this, you know, something that isn't a pharmaceutical can help you. So things like carrots and broccoli, the cruciferous vegetables, broccoli is in the cruciferous vegetable family, are very, very high in a compound called sulforaphane that has been shown to be a very, very powerful antioxidant. And people who consume high quantities of those kinds of vegetables have less cancer. And so I always tell people, you know, if your dog will eat anything, might as well give them some carrots and broccoli as treats or put it in their food and take away any of those sort of processed treats that I know they love, but
yeah,
my dogs will eat anything, and I give them broccoli or I give them a pepperoni and they're just as happy. So why not give them the broccoli?
Okay, so I agree with you. That's excellent. However, my dogs, carrots, nope, they'll chew them up. One of them, she'll chew them up, my Rhodesian Ridgeback Sava, she'll chew up the carrot and then spit them out. And so I find all these carrot pieces all over the place. Okay, so that didn't work. So
Yeah.
Should I just stick some carrots and broccoli in a blender and mix it in with their kibble?
You can do that. Now, should you do that? So that, I mean, I want the animals to be happy. I want families to be happy. I don't want this to be a chore. I don't think this should be a chore, which is why I always preface it with, if your dog will eat anything and it's not a big deal to give them a carrot instead of a pepperoni, you might as well just give them the carrot.
Right.
But blending it up and mixing it with some wet food is a great idea, especially if they'll fall for it. But if it causes them to not eat, then that's not worth it.
Right. Then you're kind of working against your plan.
Yeah, because then you got to take them to the doctor and you got to get blood work, you got to do an ultrasound, you got to test
Not eating. Oh, it's because I put carrots and broccoli in her food.
Yeah.
Back to A. Okay, we'll keep that in mind. So I know I think you have a diagram that we can share on our website when we post the video. So we'll go over that. Do you have other resources that people can maybe research more or go to? Or you've given us so much great information about how to check for a dog, where the lymph nodes are, how to do that with the palms of our hands. Any kind of closing comments, resources?
Yeah, so I think Canine Cancer Awareness group is fabulous for those sorts of things, what to be aware of with canine cancer. One other resource that I don't hear talked about a lot is called the Argus Institute. They're a group that operates out of Colorado State University, and they're all about quality of life. They even have students help with hospice care. They have a great printable or just an electronic version of a booklet called Making Decisions, which is not just about making decisions regarding cancer. It's about being in a tough position with your pet. You know, they're sick, you don't know what to do, you don't know what they would want to do, you know, you're getting advice from the doctor, but you're not quite sure, you're getting options, you're not sure what option to pick. And they also talk about how to monitor quality of life and you know, when to think about maybe letting them go. And I hate to bring that up, but you know, it's a reality of pet ownership. They have resources for children, you know, how to talk to children about a sick pet or a pet that's dying or has died. They are a fabulous organization that doesn't get nearly as much love as I think they deserve.
Wow. Okay. Those are all great, wonderful ideas and suggestions and resources that, yeah, like you said, don't want to talk about it, but we all are going to be there at some point if we haven't already. And any bit of help through that process and down that path would be fabulous and very, very welcomed. So we'll get that information too. We'll get the links and everything up.
With your donations, every dog can have the opportunity for vet care, from the first exam after transport, treatment for ongoing health issues like neglect or abuse like Squish here, or even canine cancer. So please donate now and make the difference in a dog's life, the difference of life.
Thank you, Vanessa. It is so important. I mean, just in the short year that NWCC has been up and running, I have met some dogs who have had the medical needs. We try to focus on some of those dogs that have the medical needs, to just get them that care, and also to let a potential adopter know that maybe this condition, whatever it may be, is not as bad as it may seem.
Absolutely.
And there are resources and there are solutions and treatments.
Yeah, absolutely.
Yeah,
absolutely. Every lump needs to be investigated, but not every lump is a death sentence. And sometimes it just needs a little bit of care, and then the dog can live a wonderful long life.
Yeah, exactly. And then for a potential adopter to know that, oh, that lump is nothing. Okay, I'm giving this dog a home. Or conversely, worst case scenario, oh, it is something. Okay, well, we have options, and I'm still going to give this dog a home because I have a resource now.
Yeah, absolutely. And even if it is something, that shortens that dog's life, I mean, what a wonderful gift that we can give in the last years of that dog's life, a great family, and not to just be written off because it has a bump on its skin.
Yeah, thank you. Yeah, exactly. Thank you so much, Vanessa, for your specialty and for your practice. And you probably hear my dogs in the background. They're giving you cheers too. So thank you so much. Everyone, please, like Vanessa said, we need your help. We need your donations, whether it's $500, $5,000. It helps a dog have that first exam and future exams to have a long, healthy life. So click on that donate button. Thanks,
Thank
Vanessa.
you, Kathleen.
Thank you.